All right, hey, hello, awkward intro. If you don't know me by now, I am Ethan. I'm Dr. Motykie's social media director, and most of the time you hear me asking the silly / stupid / random questions at the end of Dr. Motykie's surgical evaluation videos. But today we have a little bit of a different video for you. It's basically going to be a conversation between myself and Dr. Motykie. Somewhat random, but I think you'll really like what he has to say. But before we get into that, I just wanted to address a question that almost every patient who comes from YouTube asks me when they enter the office. And that is, what is Dr. Motykie really like? And first and foremost, I want to say I wouldn't record this. He's not paying me to say this. And I wouldn't record this if I didn't actually feel this way. I would just not do it because he doesn't even know that I'm doing this. I edit the videos and then I deliver them to him. But basically, Dr. Motykie is literally the nicest person in the world. He's by far the nicest surgeon I've ever met, but even beyond the medical environment, he's just a nice guy. He's incredibly patient. He's obviously extremely intelligent. He's super funny. He embraces the fact that I am obsessed with Britney Spears, which I think is obviously an asset in and of itself. And he is, honestly, he's just one of the best people I know. And that's all I can say about him. So what you see on screen is, of course, just a portion of who he is as a person. But if and when you meet him in person, you will find that he's extremely personable, he's easy to get along with, he's easy to talk to, and ultimately I think that that's one of the factors that you have to consider when you're seeking a surgeon. Of course, here in Beverly Hills, there are a lot of personalities when it comes to plastic surgery, and a lot of surgeons have developed a reputation for being warm or cold or dismissive, and Dr. Motykie is certainly on the warm side of that. He's never dismissive, and he really, really cares about his patients. So I just thought I would throw that into this video, and if you have any other questions for me, you can always DM me on Instagram. I'll put my handle in the description below. But for now, let's get into this conversation. So first question is, there's a lot of content online about how great open rhinoplasties are, but there's not as much content about closed rhinoplasties. Can you kind of briefly explain the differences between the two?
Briefly, huh?
No, wait. First, let me ask this. Why do you do closed rhinoplasties rather than open rhinoplasties? Or why do you prefer that technique?
Let me see if I can put this in terms you would understand. It's one of those things that, you know, once you do something that you feel is far superior way to do it, why go back? It's like if you have an iPhone 13 or 14 or whatever, and then you're like, oh, and going back to an iPhone 5, you know, you're gonna be like, I'm never gonna do that, right? So once you learn how to perform closed rhinoplasty, and you know, we all learn open rhinoplasty in training. That's the way you're typically taught. I'm not saying it's beginner technique, but that's the technique you learn in training. And then you know, if you can specialize and take a fellowship or something to learn how to do a closed rhinoplasty, once you've seen it done that way, I mean, the light bulb goes off. You're like, why are everybody else doing it the other way? Why is everybody else putting a scar on the nose? Why is everybody dismantling everything and taking everything apart and risking destabilizing the nose and longer healing and more swelling and just everything that leads to the risk of scar tissue and asymmetries later in healing? Why do it that way when there's a way that you can do it with no scars and less swelling and more predictability, and just overall the patient experience is just like, wow, this is totally different. And the way that I know that is because half of what I do is revision rhinoplasties. And of those patients, I would say 80 to 90% had open before. So a small percentage had closed before. I don't know if that's, you know, due to the technique or not, but once I see them and they had it open before and we do it closed, they go, oh my God, why wasn't this done this way the first time. You know, this has been so much easier, so much more predictable. I got the nose I wanted, and it didn't get bigger, it didn't swell up, I don't have all this scar tissue. You know, I got exactly what I wanted. You know, why are everybody else doing it the other way? And I go, I don't know. For me, or at least in my hands, the technique is far superior for all of those reasons. The surgery is quicker, which is better for the patient. It takes less time to do, at least in experienced hands. The recovery is better. You know, there's less swelling, less bruising, less pain, less everything, no scars. And then the long term as well, you know, the predictability of the procedure, less, again, risk for swelling and all the risks of the tip dropping, all these changes that can happen with the open approach, we don't see them. Because when they open that nose, a lot of times they'll even put grafts in and things that help support the nose gets bigger, and patients are like, I didn't want a bigger nose, I wanted a smaller nose. So for me, it just makes common sense. And also scientifically, and also the proof's in the pudding, the results. The patients, like I said, that have had both always tell me, oh, I would have wished I could have just done it closed from right in the beginning.
What is the approximate length of time for an open rhinoplasty versus a closed rhinoplasty?
Again, I think that the difference in time can depend on the surgeon as well, but in general, I'd say about half the time. If you know what you're doing and given both procedures, simply on the fact that, again, with the open, you're cutting and dismantling everything, it's going to take a lot more time to do that, and then a lot more time to put it all back together, versus closed, just quicker, more precise in and out, so you don't need all that extra time in the OR. And again, the longer you're in the OR, the more risk of complications, proven risk of complications, more risk of swelling, more risk of bruising, everything goes up. So the more precise, quick, and elegant the procedure, I think it's better and safer for the patient, as well as like the long term, I said, predictability of the results.
So the way I understand it, and I think you kind of just mentioned this, most plastic surgeons, or maybe all plastic surgeons, are taught the open technique while they're in training. Why do you think that they're not taught the closed technique?
I don't know. I think, well, there could be two things, I will say. The open technique, I think, in training is good because you are taking everything apart to see the anatomy, look at everything, kind of like a learning thing, right? Like when you're in med school, you're operating on cadavers and dissecting everything and learning everything. So when you open it, you see everything and everything's taken apart, so you can look at everything. So I think for learning, it might be an interesting technique. And then secondly, I won't say that the closed technique is an easy technique to learn, right? Because you have to visualize a lot of things. You're doing things upside down and backwards. So you have to have a lot of experience with that technique to learn how to do it. So I don't think it's easy to teach. And so people that are just learning to, they want to do a couple of rhinoplasties here and there in their practice, they can do the open technique and, get some decent results. But people that really want to specialize and focus on perfecting their craft and what's best for the patient and really taking time to learn a technique that, in my eyes, like I feel is superior, takes more time and it takes more skill. And so maybe that's one reason we don't see as much of it.
Were you scared when you did your first open rhinoplasty in med school?
No, but that's a load. I don't know if I should say why, but no. Well, no. Well, in all honesty, when you're training, a lot of the times the first rhinoplasties you do aren't elective rhinoplasties, right? They're more like somebody came in with a broken nose, or they got in a car accident, or they got punched and they fractured their nose, or something happened to them, and you got to go in and reconstruct it or fix it. And again, in those cases, sometimes the open approach is a little bit better, right? So those are the ones you kind of learn on, right, before you go and do all the elective ones.
What's a cadaver? I don't know.
Oh my Lord. Basically a dead person.
Oh, shut up.
Yeah. Yeah.
Really?
Yeah. That's how we learn in med school, right? So you're doing, it's called gross anatomy, and you're dissecting bodies and taking everything apart and learning all the anatomy. Yeah.
Wow. In 7th grade, we dissected a cat.
Was it alive or dead?
It was dead. So
I don't know if that's a cat cadaver, but I don't know.
I'm basically a board certified plastic surgeon now.
Cat surgeon.
Cat surgeon. Did it smell bad?
Yes. No, not because of like the body like decaying. It's because of all the formaldehyde and things that they use to preserve the body. It's probably not the healthiest environment.
And then we recently posted a photo of a patient who had just come out of the OR and she was in recovery. Of course, she looks like amazing, and I don't know how anyone looks like that after surgery. Actually, there were a lot of comments that we had hired a model and this was all planned.
Seriously?
Yes. And it was kind of nice actually, because the patient hopped on Instagram and she's like, this is actually me and this is actually how I recovered. She's just lucky, I guess. But
Or technique. For me, technique.
one major takeaway from that post is we mentioned in the caption that you don't pack most noses. And can you explain a little bit about packing the nose, and if you do typically need to do it? And just, I guess, on a personal note, I'm a little bit curious if open rhinoplasties typically require the nose to be packed, or what constitutes packing the nose?
Well, that's again a very loaded question. I think there's a lot of doctors' personal preferences on packing the nose, and then there's been a lot of changes in packing of the nose. In other words, they used to put a lot of long, stringy packing that was just medieval into the nose and pull it all back out, and it was just an awful experience for the patients. And so a lot of patients that have had rhinoplasty a long time ago are like petrified, like, oh God, I don't want all that stuff shoved in my nose and pulled back out. And most surgeons nowadays don't even use that packing anymore. And most surgeons, if you're going to pack the nose, use a little sponge that pops in and out of the nose. Now, there are other things like Doyle splints and things you can use. And I think that has a little bit to do with the technique if you're doing just a rhinoplasty or a septorhinoplasty, right? If you're working on the septum and nose, because that has some healing issues that sometimes packing can prevent and prevent swelling of that septum if you're working on it. And so I think there's also a disconnect there between, say, ear, nose, throat, facial plastic surgeons and plastic surgeons doing it, and they're training differently. Because a lot of the ear, nose, throat surgeons are doing a lot more open approaches and packing the noses and working on the septum and doing a lot of those things. Now, if you're just focusing on the aesthetics of the nose and the framework on the outside of the nose and not the septum, you don't necessarily have to pack the nose. If you're not working on the septum, not causing bleeding, not looking at the turbinates, not doing a lot of work inside the nose, there's no reason to pack it. And so patients are very happy when they don't have to do that, because either A, they've had that before, they know somebody's had it before, they've heard horror stories about it, and so that scares a lot of them off, and it's unnecessary if you're not doing those other things. And then secondly, I think there is a little bit, if you're not doing that work and then you're pulling all the stuff out of the nose, you don't want to be disturbing your work in there, the sutures, the fine work you've done inside the nose, not the breathing work, but just inside your nose. So I think I try to avoid that if we're not doing all those other things.
There seems to be a perception, at least among our audience or your audience, that breathing correction cannot be done in a closed rhinoplasty. It can only be purely cosmetic.
What?
So, can you just address that for me?
Yeah, well, breathing work has nothing to do with open versus closed rhinoplasty. The technique you're doing on the outer part of the nose really has nothing to do with the inside breathing work. So you can do breathing work with open or closed rhinoplasty. It doesn't really matter. Either technique, you can do the breathing work inside the nose.
Yeah, I think it's kind of interesting because when we see post-ops, a lot of patients, even if they didn't or weren't aware of the fact they had breathing issues, pretty often we hear like, oh my God, I can smell so much better now, or I can breathe so much better, or I sleep so much better. And for most of them, it's kind of like an unexpected benefit.
Yeah, well, it's interesting when I ask a patient, do you have a breathing problem? And they're like, I don't know, this is the way I breathe my whole life, right? I mean, some people, obviously, they know and they're having horrible deviated septum or things going on. But a lot of patients aren't aware. It's the way they breathe their whole life, and they don't know. They're like, oh, do they snore? Yes. Do they have, are they more congested in the morning, have some issues? Yes. But then once you fix it, yeah, they're like, oh my God, like, I didn't know, like, my sleep is so much better. I have more energy. I can breathe better. I can smell better, taste better because you can smell better. And they're just like, this is wild. I never even knew, that I had a breathing problem.
If you have a rhinoplasty, is there any chance that like you won't be able to smell afterwards?
Long term?
Yeah.
Yeah, there's a small, very small. I mean, you'd have the crib. I don't want to get complicated, but there's a little plate up here called your cribriform plate where the nerves of smell come down through. And if you had fractured that or caused some issue where the airflow is compromised up there, it could affect smelling. But in general, I mean, it's exceptionally rare.
Crazy, you know so much stuff about the inside of your face.
That's probably a good thing.
It's your job, right?
I do need to know those things. Yeah, I mean, those are all the things you want your surgeon to know about, right? And another good thing, like I said, for somebody to have that training, because when you're doing the nose, you should always be looking at the rest of the features, the facial features, and know your anatomy and what you don't want to be risking complications from. So all that comes into play if you know your anatomy and know everything else, so that you're just kind of getting rid of all those risks and you're just focusing on what you need to do. But the people that are too tunnel vision and they don't really know and they haven't taken a lot of training with the rest of the face, it's not going to be, that runs some risk. So those are the things that I think people sometimes underestimate. And they're going to go fly off to another country, or what was their training, or what did they do? They're doing rhinoplasty. Well, what did they train in? How much experience do they have? Have they done the whole face? Are they a dermatologist, a plastic surgeon? What are they? So I think that comes into play in my brain. I think you visualize, at least I do, three-dimensionally, and maybe that is why I like closed rhinoplasty, because my background before surgery was engineering and looking at things and thinking about things in three dimensions, right? So when I'm doing that surgery, I'm able to visualize it upside down and backwards and see those features. So maybe that is something that some other people can't do. I don't know. But I personally enjoy it that way, and my patients enjoy it that way. So it's a win-win.